Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screenings for cancers, Central Care Cancer Center is here for you. At any time during our conversation today, feel free to email with any questions or comments. askdoctor@cccancer.com. That's askdoctor@cccancer.com. And Doctor, just an update. Last month, we talked about cancers that affect women, such as ovarian, uterine, and cervical. And Cindy had sent us an email to askdoctor@cccancer.com asking if you could speak on vulvar cancer. Now, unfortunately, Cindy's sister was misdiagnosed and mistreated for a couple of years, and she passed away from this cancer. But she asked if this cancer is usually caused by HPV.
Thank you, Leanne. Yes, indeed. In fact, this is the sad part about many cancers, including breast cancer, which we will talk today, but vulvar cancer and anal cancer, both of them are misdiagnosed almost invariably. So I encourage people to come and see us, even if they don't have the diagnosis on their own, if they have questions about a lesion around the vulvar region in particular. And I can tell you immediately whether it needs to be further assessed by a specialist. It is caused by HPV, and it can look many ways. It can look like a wart. It can look like a flakiness. It can be itchy. It can be painful. It can have bleeding. But many times it looks rather bland, and that's why misdiagnosis is not uncommon. The early detection and early treatment of this is key. This likes to go to the lymph nodes very early on and then to the blood system and metastasize to bones and other parts of the body. So if you do not get it early, it is, in fact, we have a lady right now that we're treating for another cancer, and she was diagnosed with a tiny, and I'm talking a 1/4-inch lesion around the clitoris, and now she has lymph nodes as well. So they can go quickly to lymph nodes or the system even when they're tiny. So the importance of knowing your body, because women are, they are accustomed to checking their body because we have our periods, we have issues in that region of the genital. So we're able to feel or think we have something that does not belong. And that's the time to come and see someone. And if you don't get satisfied, come and see us. Please do.
Yep, second opinions. That's right. Thank you, Doctor. And as always, you can send your questions or comments to askdoctor@cccancer.com is the email. And Doctor, it's that time of the year. We see a lot of pink around us. October is National Breast Cancer Awareness Month, so our discussion centers around breast cancer. And I didn't actually know where to start with this. And where would you like to start as far as, there...
I'd like to start with the Early Detection Works program so we don't forget about it.
Okay.
Because I think it's helping women getting the breast or cervical cancer screening in Kansas. And I think that getting involved with them right away, if you are a candidate, is key to, having support by the state to get your screening and your pap smear. It is something that it's offered for women between 40 and 64 years of age. It's a screening protocol. It will cover, you don't have to have health insurance. In fact, it is primarily aimed for people that do not have health insurance or are underinsured. And the eligibility is guided on the federal poverty guidelines of 250%. So you can be one of those people that requires a little more assistance, and enrollment is easy. Now, it is key. This is what I want to highlight about this program. Like many programs, and we have quite a few, is that you need to get in the right moment. if you have an abnormality either palpable on the breast or by mammogram and they biopsy, you are no longer eligible because this is a screening program. So what it is really paying to get detection done early. So please, if you think you need assistance in this regard, make sure to either talk to your primary care physician or come by our Central Care Cancer Center, and we can give you information about this detection program that Kansas has.
And again, it's called Early Detection Works Program here, helping women get breast and cervical cancer screenings in Kansas. That's a great way to start, actually, Doctor. So is there one specific location maybe where breast cancer begins?
Well,
besides obviously the breast,
there are actually several histologic possibilities in the most common is called intraductal carcinoma, and it could be in situ, meaning in place, meaning it hasn't gone outside the duct, or it can be invasive, meaning it has gone outside the duct. Then the other part of the breast apparatus is the lobule, or what makes the milk. And that's lobular carcinoma. And both of them have a little bit of a different prognosis and a little bit different presentation, but they're both treated about the same way. Now, imagine your breast being like a shrub where the nipple is the trunk of the shrub and you have the branches inside you and they all end up in a little lobule or flower, let's say a cul-de-sac. Okay, the cul-de-sac or the flower is the lobule and the branches are the ducts. Now, you can imagine just like any shrub, as it gets nearer the trunk, the ducts get bigger and bigger. Most of the cancers actually are of the smaller ducts. So the ones near the nipple, which are the larger ducts, are not as common, and they may have some symptoms like discharge from the nipple. But it is not common. Adjusting your bra, and all of a sudden you feel a lump. The screening, although very useful, you need to be screening your breast all the time, because positions can bring out lumps that are not necessarily something you can feel while you're sitting up or in your shower. It may be while you're lying down recumbent, or maybe you're in a certain position that brings out the lump. So this is the number one detection. You are your best detector. Many people go, but I went to the doctor. Well, the doctors are only going to examine you in a certain way, and it's a one-time a year exam that really is very little. They don't know your breast as you know them. Many women have cysts. They're just normal in breasts, called fibrocystic disease, or just little cysts here and there. Breasts are actually dynamic organs that when we are growing up, they change depending on our cycle. And when we have menopause, these little changes are actually remnants of what happened before. So a breast cancer feels hard. Unlike a cyst that feels lumpy, it is not lumpy, although yes, it can be lumpy, but it's hard like if you had a bean in there, like a dry bean, or if it's bigger, like a stone. It is hard. Sometimes it's movable. Sometimes it isn't. So noticing this is the first step into knowing that you have something wrong. Now, of course, the mammograms can detect cancers. Screening mammograms can detect cancers as well. And also MRIs can detect cancers as well. When you have especially nipple discharge or a family history of cancer of the breast, or you have a genetic mutation, you may be a candidate for an MRI, which is more prominent or more important for cancers that are early on into the ductal system. They're able to really look at the ducts inside the ducts. And the mass, when you feel a mass, usually it is that the cancer has gone outside the duct. So imagine the duct being like a sausage. And if you pierce the sausage and the sausage goes out of the casing, the stuffing goes out of the casing, that would be the cancer being invasive. So you have to be very diligent. There are things that are going to make the cancer grow, because these cancers are estrogen driven. Most of them are.
I was just going to ask you if hormones play a role in sometimes, what these cancers do.
They do. The cancers, both lobular and I'm going to talk mostly about the garden variety, which is the ductal carcinomas. We'll talk about the lobulars a little later, but think of it as Pac-Men. They have mouths, and the estrogen is like fertilizer to the cancer, so it makes it grow. Not all cancers are actually estrogen positive, but most of them are, even to a slight degree. So what does that mean? It makes the cancer become more robust, happier, growing, better. And so things that have estrogen in them, for instance, of course, estrogen pills, estrogen patches, but mostly actually estrogen in exogenous or outside, in other words, milk products that have extra estrogen in them. Many of the meats have estrogen in them. Things that are, a product of pregnancy, let's say milk, has added estrogen. So you can actually be stimulating your cancer by certain foods or growth factors, like, for instance, many of the non-organic meats, shrimp, fish that are grown in ranches are given growth factors because they want to have the animal grow faster so they can go to the market. So when you have growth factors, you actually are growing your cancer. But actually, our own fat is actually going to give you more estrogen than anything else.
Really?
Yeah, so being menopausal does not mean that you are not highly estrogen driven in your cancer. Your adrenal glands are forming some estrogen because we are women. We continue to have estrogen, but our fat is going to be our number one enemy. So here again, and there's been many, many protocols that put you on a weight restriction and an exercise program to be able to decrease your estrogen and therefore not promote your cancer. So once you have cancer, you really have to understand that, especially for women that want to have children or are still having cycles, this will change because of the way your cancer is going to be promoted by the estrogen.
I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo, and we've been talking about breast cancer as October is National Breast Cancer Awareness Month. Again, you're welcome to email with specific questions. Ask doctor@cccancer.com. And doctor, I wanted to start off here by saying something that you always say, and I know that you mentioned it already here too, but be your own advocate. You know how your body feels. If something feels out of place or wrong, talk with your local provider. And that goes as well with your screening test, your self-exams. And that's why you should do it every month. Because the minute that you find something that's maybe a little bit out of place, then it's definitely worth getting it checked out.
Absolutely. You know your body better than anybody, or even you have an inkling that something isn't right. Usually people, when you have something that doesn't make sense to you, I always tell the story, for instance, if you are smelling something that isn't there, it's a very small and not maybe to some people important sign, but it's a seizure. You can have a seizure that is very, just the detection of it would be hard because people say, oh, maybe somebody's making oatmeal next to me and I'm smelling oatmeal and there's no oatmeal. You need to have the ability to recognize that there are things that don't make sense. If you are examining your breast, you need to consider it like a clock, and it needs to be with intention. It's not just feeling around like if you were, putting a pillow in your bed. No. You need to really feel it. Feel
That's
it.
so true.
Yeah, it has to be with intention. So you start with a nipple, and you go around in circles like a clock, 1 o'clock, 2, 3, 4, 5, 12, and then you go to the next circle, and then you may, and this needs to go on in different positions. Sometimes just be aware that you're feeling for lumps. The lumps can be, most of the time when it's cancer, can be very hard. As I said, like a stone, but they can also be mildly hard. The size is also important. If they're big, like we're looking at a ping pong, for instance, that's not a normal cyst. So if it's small like a bean and it's firm like a stone, it is not supposed to be there. So you need to go in and have somebody look at it and get a mammogram.
Your breasts, they could be tender as well, correct? Or
you can have tenderness. You can also have, and this is a very aggressive cancer, you can have changes on your skin. It looks like a rash, like if you were in poison ivy. And it could even be painful or swollen. It could make your arm swollen. And you may think, oh, it's an infection, because it looks like an infection, but it is actually a very aggressive form of cancer called inflammatory carcinoma. So, and nipple discharge, there may be no lump. It could be just a discharge, and it doesn't have to be bloody. It could be just clear. So you need to be aware that you can't dismiss it as, oh, it's just nothing. No. Better to find out. And remember, mammograms, especially for the larger breasted women, mammograms, they press on your breast for a reason. Oh. And the most painful, the better. I know I hate to say that. You need to almost market it. We give you the most painful mammograms. That means they do it well. So unfortunately, women are like, oh my gosh, do I have to go there and get my breast squeezed into a pancake? And the answer is yes, they need to do that. So to be able to see, you need to have this distension of the parenchyma or the breast tissue, or you can't see anything. Other things you can detect, for instance, is under your arm, there could be lumps, and those are usually lymph nodes. Sometimes the cancer is so small, especially for the larger breasted women, that you don't detect the mother tumor, but you do detect the lymph nodes. So lymph nodes are filters. They filter impurities, and they're underneath your armpit, basically. In your armpit, they can also be below your clavicle or above your clavicle, your collarbone. So feeling these areas are also important. And if you have a lump, and these are usually soft, they're not hard, it needs to be investigated. There are many reasons why you can have this. In fact, if you shave your arms, you can nick your skin and cause a lymph node to become hyperplastic. That doesn't mean cancer. But lymph nodes are filters, and when you nick yourself, you're actually exposing your skin to the bacteria on the skin, and therefore the filter of your axilla detects it. But even if that is the case, if it's a certain size, let's say it's a quarter of an inch or bigger, and it doesn't go away, you definitely need to go and have it checked out.
Let's talk a little bit, too, about genetic counseling and testing if you've got a family history of cancer, breast cancer. Maybe just speak on how important, that is with breast cancer.
Many of the cancers, women with cancer, and remember that men can also have cancer. Yes. Anyone that has breast tissue, which is all mammals, can have breast cancer. That includes the dogs, the cats, everybody. If you are if you have breast tissue, if you're a mammal, you have the potential. 1 out of 10 cancers are in men, and usually they're actually more advanced. You would think not. So think about these ladies. If men who don't have a lot of breast tissue have advanced cancers of the breast almost uniformly, imagine a woman that is a D or above, a cancer cup. It's very hard to detect sometimes because you think it's nothing. So you want to, feel your breast and make sure that you feel it fully. So the different
genetic,
the different genetics on it is actually not as common. Most cancers are not genetically based, but you become what we call an index case. So if you are the first woman in your family to have cancer of the breast, you're called an index. What does that mean? It means that everybody that is your family members, let's say your children and your daughters, are now double the number of the potential for cancer of the breast. In the United States, 1 out of 8 women will have cancer of the breast. Now they have doubled to 2 out of 8. So it's not like 50%, but it's a whole lot more. But it used to be that only if you had a very strong family history of cancer of the breast, you would be a candidate for genetic testing. Not anymore. People have figured out that all women that have cancer of the breast, especially for a certain age, can have a genetic test. And these DNA mutations, a mutation means that there is something in your genetic material that has gone wrong. Let's say a short circuit. And these short circuits or genetic changes can be detected, and you can have a high risk if you have a lot of women in your family with breast cancer, or if you have other cancers of other parts of the body, including if you have a lot of prostate cancers in the men, or if you have cancers of the colon, if you have cancers especially of the women organs like the ovaries or uterus. These put you at a higher risk. And therefore, you have a genetic test, which is a blood test, very simple. Most insurances cover it. And then you know what your cancer risk is on the other breast and also in your children. because how we deal with a cancer of the breast initially and your choices are based on also genetic results.
Like, I never even thought about that. If you did have like a hard lump in one breast and then you do the genetic test, it could tell you then maybe if the other breast, I assume, would have
yes, at
cancer
risk.
as well.
You know that there are celebrities that have removed their breast because they're BRC positive, because you reduce your risk, not to zero, ladies. This is the important fact. Removing your breast, of course, puts you to the lowest number possible of your risk. But because you still have your skin, you still have some risk of breast cancer, even if you remove your breast. The same thing with ovaries. If you remove your ovaries, you still have a chance of getting cancer of the ovary. So even though it's small, much smaller than if you have it, you will still have to be aware. Now, if you have a genetically involved breast cancer, then your choices are really about what do you do with both breasts, not just one.
I want to ask you, because we get this question sometimes at some of the booths that we're at with women's fairs, health fairs, and that kind of thing. And that is, I have implants. Do I still need to do my self-checks and get a mammogram?
This is very common, especially when women, in fact, have an implant done when they're very young. Many times their breast tissue is not removed. In fact, often it is not removed, especially the older implants. And therefore, you still have breast tissue. And again, even if they remove your breasts because you have a higher genetic risk, or even if you don't know if you have a genetic risk, you still have breast tissue. So yes, you are at risk. And unfortunately, when you have an implant, it's much more complicated because feeling below the implant is very difficult. And you can have risks below the implant. In fact, women with breast cancer that by choice, they want to deal with it with a mastectomy and a reconstruction, they still can get breast cancer underneath. And it's very hard to detect. So this is one of the reasons why, if you're at very high risk and you do want a mastectomy, I do suggest to people, wait to have reconstruction until you are out a little bit away so you can make sure that your risk goes down. Because really the risks are primarily in the first 2 years, and then it reduces somewhat. So you can always have reconstruction, you can always have aesthetic changes with surgery, and it's not an emergency. So if you do have an implant just because that's the way you want it, it has nothing to do with breast cancer, you still have to be aware.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been talking about the risks and symptoms of breast cancer, and now I want to get into prevention and treatment as well as breast cancer in men. As far as lowering your risks for breast cancer, it's a lot of lifestyle changes that I would assume you'd have to go through, correct, doctor?
There's no doubt, and of course, if you are one of those individuals who have a high risk of cancers of other types, and breast cancer is one of them, the number one prevention is to seek screening, and the frequency, which will be depending on how risk is your risk. And sometimes mastectomy is necessary as part of the prevention. But also, there are many hypotheses that are not scientifically proven, but have floated in the journals about, for instance, smoking is one of them. Smoking can heighten your risk for breast cancer. Certain deodorants can heighten your risk. And please, ladies, remember your skin, and men too, your skin is like your mouth. In fact, you know that there are many medicines that can be delivered through your skin. So if you put anything on your skin, anything, and deodorant is one of them, it's going to be absorbed into your circulation. So if you're going to put something toxic that is going to go directly to the breast because the lymph nodes and the breast are attached, then you're going to have a heightened risk. Of course, eating things that are organic solvents in particular, things that are not raised organically, you're going to have these organic solvents are mostly lipophilic. We call it lipophilic. What does that mean? It means it likes fat. So anywhere where there's fat, which includes your breast, your brain, your ovaries, your testicles if you're a man, you're going to have these chemicals primarily go there. So be aware that your skin can be a receptor for absorbing things that are not there. And what you eat can go to different parts of your body and produce problems.
So there's several different types of breast cancer. And one of them, I spoke to a patient for Breast Cancer Awareness Month that had the triple negative, which is, again, an estrogen-fueled type of cancer for breast. Is that
No,
right?
in fact, the opposite.
Okay.
The triple negative cancers are particularly nasty. Why? Because it means they cannot be manipulated through different medications that are targeted to this receptors. As I told you, remember the Pac-Man with mouths. The mouths are estrogen receptors. So if you don't have a mouth, meaning you're round, you don't have a way of having something come in and attach to you, you can't manipulate it. So triple negative means that it's not estrogen, doesn't have an estrogen receptor, it doesn't have a progesterone receptor, and it doesn't have a HER2 receptor. So think of it as one of those children's toys that has a circle, a triangle, and a square. So you don't have that. You're just the tumor's a round ball, and therefore attaching something to it and turning it off, because these receptors are like keys. You can turn the cancer off. You don't have. So what happens is you need something more toxic to be able to get rid of it.
It's just like the HER2 now, like you had mentioned, that isn't like another form then of breast cancer that you commonly hear, I think, from patients too.
It's not a form, it's actually a receptor. Remember, again, receptors are like keyholes that if you put the right key, a HER2 key, and turn it off, you're able to manipulate the cancer, and therefore your treatment options are bigger, their horizons are broadened. If you don't have that, and we're going to be discovering more and more, I mean, there's so much work being done on receptors that we just don't know yet about. Unfortunately, many of these receptors are on other organs. So you can imagine as a woman, you have estrogen receptors everywhere. Why? Because we are estrogen driven. That's why we grow breasts. That's why we don't have a beard, or at least some of us don't have a beard. That's why we have ovaries that work. So anything that is estrogen driven can be affected by an estrogen hormone manipulation.
And as far as other treatment goes, I mean, it's pretty typical to do, lumpectomy as far as surgery goes.
Well, the treatments are very broad these days, and here it is not a smorgasbord. Here, I think people have this understanding. There are people that have a lot of choices because their cancer is small, because it's in the right spot, because they're not, the mutations are not there. You don't have a hereditary type of predisposition. But the whole point of lumpectomy is to give you a good aesthetic result. So you need to go to a doctor that's going to do a lumpectomy. It's going to leave you with a breast that is nice looking. And we don't do the big surgeries anymore where you'd remove all the lymph nodes and you remove the breast. And in fact, the chest wall used to be removed as well. Those are no longer something we do. Why? Because there are things that actually cover all those areas. The breast cancers go to lymph nodes, which are all over your breasts. They're actually below your muscles. They're in the axilla. The axilla has 3 stations, and there's hundreds and thousands of them. So in the axilla, there's station 1, 2, and 3, and then it goes into the clavicular area, so above the clavicle or the collarbone and below the clavicle. There's also ones that are below the sternum and called the internal mammary chain. So depending on where your breast cancer is, if they're inside, in other words, if you can imagine your breast like a quadrant system, the inside quadrants are near the sternum and the outside quadrants are outside, and they will go more directly to the axilla. If you have a lymph node in your axilla, your chances of having lymph nodes in the internal mammaries is 30%. So if you already have one node involved and you have an internal quadrant lesion, you have to treat the lymph nodes that are not removable by surgery. So now we rely on radiation and chemotherapy to take care of any risks, chemotherapy in the blood and radiation in the lymphatic system. Because these cancers don't jump. They don't go from your breast and then they jump into a lymph node. They go through these tracks like train tracks, and they go to the different stations, and these stations have other tracks that go to other lymph nodes. So you have to treat the tracks as well as the lymph nodes, and these tracks are actually below the skin or in the skin and into the muscle. So you can imagine that removing your breast is not going to remove the tracks because they have to cover you with the skin that has the tracks in them. So we don't do mastectomies unless the skin is involved, and we do it because this way it's a more advanced cancer. But there's other choices. You may have, maybe you're interested in reconstruction, maybe you're interested in having a double mastectomy if you have a high risk of having the cancer be on the other breast, and you're young, the age is very important. If you are premenopausal, your risks are much higher than if you're postmenopausal.
And again, we cannot forget men. You still run a risk as well of getting breast cancer. Similar symptoms to women, is that correct, doctor?
Yes, in fact, exactly the same, and they're treated exactly the same. But interestingly enough, many men cancers, perhaps cancers of the breast are not something men think about, so they let it go until it becomes very advanced. And why is it very advanced? Because once it involves the skin, your skin is an organ. So, and it's an organ that basically is all over your body, so it's contiguous. So if it involves the skin, your chances of having skin involvement everywhere becomes a huge problem. That's why the inflammatory carcinomas, in other words, the cancers that involve the skin, are so difficult to control because the skin is an organ that is contiguous. So many men, because their ratio of breast tissue is so small, so imagine a woman that has a triple D breast, and they have a cancer that's an inch. That is small compared to a woman that's an A cup that has an inch cancer. And the proportion is very difficult and very different, and the way to treat it is very different. Likewise, a man that has almost no breast tissue, but they have a lesion that is now involving the musculature, the skin, or the ribs. So it's not so much, I think, that it's just let go. It's that just there's not a lot of breast tissue, and then it goes into the lymph nodes early on.
Anything else you would like to add about breast cancer?
Well, not really about breast cancer, any cancer. If you feel that you have something and you're not getting answers, this is why we're here. We're here to be available for you. You can come to the clinic or call us. If you have a concern, we can direct you where to go and what to do.
Thank you so much, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials, financial counseling, or other supportive services for yourself or your family, maybe just even a second opinion, Central Care is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110, or you can visit us online at cccancer.com. You can always send an email as well, askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.